Hi, everyone. My name is Selena Belisle, and I am the founder and one of the instructors at CE Institute. We teach both hot stone massage and oncology bodywork. And we wrote an article that was published by Massage Magazine this month called Hot Stone Massage with Oncology Treatments, Possibilities and Contraindications. For those cancer patients and survivors out there who have always wanted a hot stone massage, we are saying this is possible in some scenarios, and we're going to review those today with you. Now, if you'd want to see this article in more detail, you can find it at massagemag.com, and then you can search within their website for something like Hot Stone Oncology, and you should be able to find this article on their website. We're also featured right now for our hot stone safety practices and protocols on the cover of Massage Magazine of their May 2021 issue. So there are several hot stone safety articles that we have recently written for Massage Magazine. And if you don't get to train with us here at the school, we hope you can find them at massagemag.com. Today, what we're going to do is we're going to review hot stone massage specifically with 3 different oncology treatments. There's surgery, radiation, and chemotherapy. These 3 different oncology treatments will be received by the majority of United States cancer patient diagnoses. It's estimated in the United States, we have 16.9 million cancer survivors alone. And by 2030, we'll have a total of 22.1 million people in the United States who are still alive, but have been diagnosed with cancer. Some of those might be in remission. Some of them might be actively fighting cancer. And there are different ways that you can practice with these clients based on what stage they are with their cancer in their life. Now, it's very important that all practitioners try and learn a little bit more in working with cancer. There's a very good possibility in your career with this increasing populace that you will have cancer patients and survivors at your door waiting for massage. And it's really hard to say no to somebody who's had cancer because they have cancer. You're not going to work on them. Okay, so we hope that all of you go out and get oncology training, and maybe that's one of the reasons you're starting with this video here. So thank you for that. We have become really good as a country and the whole world in fighting cancer. 25 years ago, 30 years ago, if you were diagnosed with cancer, the big C, it was almost a terminal experience. There were very few modalities available like what we have today. Today, we've become really good at getting cancer patients into remission. And they might, live the rest of their life with some side effects. And those are usually the medical issues that you have to deal with as a massage therapist, and definitely if you're going to practice hot stone with them. So the primary oncology treatments that we're going to review today between oncology surgery, oncology radiation, and chemo, we'll start with surgery. In surgery, it's usually an acute situation. The tissue is cut, cancerous tumors are removed, and then they're, stitched, and hopefully they get all the cancer. It's a curative surgery. And when this happens, you will have some acute swelling. Swelling is usually a massage therapy contraindication. Okay. The thing that you would want to watch out for with hot stone massage and oncology surgery or any form of surgery is the dermal scar where they removed the cancer. That is going to be sensitive and possibly prone to burn. So you want to make sure if you're going to do hot stone massage for a cancer patient or survivor, if they've had oncology surgery, avoid the area where there is a surgical incision because that tissue is compromised where it's been incised and can burn easily. Now, also in surgery, sometimes they need to retract major nerves, and this can damage the nerve or cause numbing in the area. So if there's any type of nerve damage, of course, the client must feel the heat of the stone to have it applied to them properly and professionally. So make sure that their feeling is intact and they have not lost any nervous sensation from their oncology surgery prior to practicing hot stone massage with them. The next oncology treatment that we're going to review is oncology radiation. Now, there are some patients that had radiation 50 years ago, and the radiation 50 years ago was pretty barbaric. It is almost like a burn to their tissue, a permanent lifelong burn. And any type of tissue that's already been burned is more susceptible for future injury and burn. So if you're practicing hot stone massage, this is another local massage therapy contraindication. You would never apply a heated stone, especially in maximum operating temperature, to an area that's been radiated. Many times on your radiated clients, you might find these little tiny dot tattoos. It almost looks like they took a pen, like a blue or a black pen, and they mark the skin. It's actually a permanent tattoo. And when they do this for radiation, it just gives them a focal point to make sure they're radiating the same area. Now, today there's different laser therapy radiation applications where they beam from different areas of the body with active ultrasound and so forth. So not everybody gets tattooed anymore. But some of those older radiation cases, you'll often see the tattoos. And that's definitely the X that marks the spot. You don't go near that area and you stay several inches away from it, because that tissue is likely extremely compromised and you do not want a hot stone anywhere near it. Of course, radiation destroys all tissue, not just the cancer. So if they've had radiation, again, you need to be concerned with nervous loss of sensation. Make sure they can feel the area and that you are not applying hot stone massage to any area that they cannot feel. The last of the three treatments I'm going to go over with you today is oncology chemotherapy. Now, we do not have a lot of good data or information about applying hot stone massage from somebody who's been recently infused with chemotherapy. But one of the things that does happen with chemotherapy is it's metabolized by the tissue. And we want to make sure that there's an appropriate metabolization of that lethal drug that kills to be able to effectively treat the cancer. So we're going to ask that practitioners not provide hot stone massage thermal therapy immediately after the chemotherapy is applied. Sometimes with some of these chemotherapies and radiations too, it can be done intravenously, where this material is going to an organ and so forth. So you might want to check with the oncologist and make sure that the increase of circulation to that client will not affect their chemotherapy or radiation treatment. Again, anybody who's working in oncology should already have some oncology knowledge and education. We review these three treatments and more in CE Institute's oncology bodywork classes. And we recommend that you get that training with us or anyone prior to working with anybody who has cancer. Because when they have active cancer and they're fighting it, this often can create some contraindications. We feel that the practice of hot stone massage for people with chemotherapy can be wonderful. One of the things with chemotherapy is sometimes the cancer patients can often feel cold. And so this is one of the nice reliefs and additional benefits of practicing hot stone with chemotherapy clients is it can improve their temperature and feeling warm again and feeling healthy. Hot stone massage in the nervous system. As I've explained with these three different cancer treatments, even with chemotherapy, often there can be things that, such as neuropathies, that can be unfortunately result in chemotherapy treatments. Sometimes when they're aggressively fighting an aggressive cancer, they will really push the chemo beyond a little bit more so than might be traditionally administered. And sometimes when that happens, the nervous tissue is affected. So you'll have areas such as the feet will feel numb, or, when they're walking, they might have balance issues of staying on their feet. Any area that a client cannot feel should not have a hot stone applied to it, because if it's too much heat, they're never going to be able to feel it and tell you that it's too much, it's burning them. Now, chilling with oncology treatments. Many oncology clients, not just with chemo, but many oncology clients can feel cold. And that's one of the nice benefits of hot stone massage instead of regular Swedish massage, is that thermal therapy can be really enriching to a cancer patient and survivor. Now, one of the things that needs to be considered in your oncology hot stone practice are lymph nodes and swelling. Any form of swelling is considered a massage contraindication, not just for hot stones, but for any form of massage, except for lymphatic drainage, which isn't a massage. It's often practiced by massage therapists, but lymphatic drainage is a series of manual techniques to relieve swelling. Okay, so we would never apply hot stone massage or any type of thermal therapy in an area of swelling that would likely lead to vasodilation and increased swelling to the area, which would probably be quite painful for the client. Now, why do we talk about this in an oncology article? When you have cancer, one of the ways that they're testing to see if the cancer is metastasized is to often check the regional nodes to the area of cancer. That's one of the first places that cancer usually metastasizes to, are lymph nodes. And if cancer is found to have metastasized to the lymph nodes, they often surgically remove them. They might radiate the area. And when you have the lymphatic tissue doesn't grow back, when you have a permanent destruction or removal of lymphatic tissue, that can often lead to swelling in the local area. Now, fatigue and frailty with cancer. When you are when a cancer patient or survivor, you can have a deterioration of skin, muscle, or bone, or any combination of the three. It could be all of them. And when it comes to oncology and hot stone practice, you might have someone, I think the number one side effect of a cancer patient who's actively having treatments, or just anybody with cancer, is fatigue. Okay, I think it's something like 90% plus of cancer patients report fatigue with their cancer diagnosis. So one of the important things in hot stone massage is to constantly verbally communicate and make sure the stones are comfortable temperature. But if your cancer patient just needs to sleep, needs to rest, I wouldn't recommend practicing a hot stone massage. You might want to practice something that is not something you need to verbally check in on every time you enter a new area of the body when you're working on them. And in hot stone massage, you should be checking in with your client every time you work a new area of the body. Also, cancer can have an enormous effect on human bone, often making bones into a weaker condition. And so we want to be very careful when applying our stones that we're not running into superficial bones, such as the spinous process of the spine. You want to make sure that you would always avoid bone with stone massage, but doubly avoid bone with stone massage with cancer patients, because their bones can often be brittle and weakened from the cancer and or cancer treatments itself. Now, again, very important to have oncology training prior to working to cancer patients and survivors. So we hope that you all get that, because there are many other factors beyond anything we've discussed here, such as there's this palmar plantar erythrodysesthesia. It's called like a hand-foot syndrome, and you might see like the hands or the soles of the feet are they'll be red and chapped skin. You might think, what's going on here? Did you burn yourself? Did I burn you? No, it's just a side effect that can happen with some cancer treatments. Also, many cancer patients who are taking chemotherapy could have mouth sores. You would never put them them in a face cradle. That's why at CE Institute we do a side lying massage in our Swedish oncology training. Many cancer patients should be in side lying position. Breast cancer is the #1 cancer in women in the United States. And many women who are going through mastectomies and so forth, or breast cancer treatments, they might not feel comfortable lying in the prone position. And then the nasopharyngeal cancers and the mouth sores, all of these can't be in a face cradle. So learning side lying is another great way to work with cancer patients and survivors. So modifying your hot stone treatments for oncology treatments. We did a little bit of thinking about this, and we know that there's cancer patients and survivors out there that want a hot stone massage. You know, it's maybe their life dream, or it's on their bucket list and they want to go on vacation and receive this. And we shouldn't just be saying blanket no to all cancer. That's silly, because there's many cancer patients and survivors that can have a modified hot stone treatment. If they can't have a full body treatment, think about modifying. We did like a surface area count, and the arms and legs, the extremities of the body, make up more surface area than the head and torso. Okay, so to be able to administer hot stone massage, you might be able to do your regular massage maybe on the back, but if there's something going on, maybe they have an esophageal cancer and there's radiation happening, you can just skip the hot stone for the back altogether, and then just do all the arms and legs with a hot stone with an esophageal cancer. And maybe you'll fulfill their bucket list or lifelong dream of having this nice hot stone massage and what everybody's raved about. And now they've had one too, which is really wonderful. So think about most cancers, they might be throughout the thorax of the body, unless you're working like with a skin cancer. You should never apply massage to a cancerous tumor, whether it's with a stone or not. But many cancers, soft tissue sarcomas make up only about 1% of all adult cancers. Okay, most of the cancer is usually in the organ areas, in the reproductive areas, prostate and breast cancer being #1 cancers for men and women. So you usually can do hot stone massage for these cancer patients and survivors by just avoiding the area and making sure that you're not doing anything that would be harmful with their cancer treatments. Now, unfortunately, we can't go through every possible scenario. This isn't a do and don't list for all cancer patients and survivors. You should have oncology training and then doubly hot stone training before practicing hot stone massage for a cancer patient or survivor. But we offer both here at CE Institute. We'd love to see you at the school and any of our trainings. It's ceinstitute.com, and we hope to find you in one of our classes. Thanks, everybody.